get ready to kickstart your journey to wellness with the ultimate guide in town. Welcome to Wellness Unleashed with Doc Stone. Join us as we journey through the realms of natural healing, where ancient wisdom meets modern science. Prepare to be inspired by stories of transformation and triumph. With Doc Stone as your guide, discover the power of holistic living and the joy of reclaiming your health. Prepare for a whirlwind adventure through the world of holistic wellness. From fitness freaks to spiritual gurus, we've got something for everyone. So grab your sneakers, your yoga mat, or just your sense of curiosity, and let's dive headfirst into a world of wellness wonders. Wellness Unleashed with Doc Stone. Your path to a vibrant life starts now. Well, hello and welcome back to Wellness Unleashed with Doc Stone. I'm your host, Jeremy Doc Stone. Welcome to the show where we empower you to take charge of your health naturally and holistically. Today, we're going to be tackling a deeply personal and complex topic, cancer. While conventional treatments like chemotherapy, radiation, and surgery are the cornerstone of cancer care in the Western Hemisphere, many individuals are exploring how holistic, natural, functional, alternative, integrative, and complementary medicine can support them on their journey. It's about treating the whole person, mind, body, and spirit, and enhancing the quality of life while going through your cancer journey. Before we get started in today's topic, I do want to make sure that we understand that everything that we talk about here today is for information and educational purposes only. It is not intended to diagnose or treat any disease. Please make sure that if you have any medical condition like cancer or any other, that you consult with your healthcare practitioner. Also, we want to thank our sponsors for the show today. First, we want to thank Aerostream TV Network. A new network that's bringing this show to you on major streaming platforms across the world. If you want to get your message out into the world, this is the network to be on. We want to help you to do that. Shoot us a message and we'll help you to get your word out on the network. It's also brought to you by our practice, our holistic health coaching practice, Doc Stone's Natural Medicine and Wellness, where you can make wellness natural. All right, so let's get started here with our show today. We do want to talk about, navigating cancer care with holistic harmony. I think so many times we get so focused on the conventional medical treatments that we forget that we have a whole body approach that's called holistic medicine. We want to make sure that we're not treating just the symptoms and trying to kill the cancer, but we want to support your body, make sure that you are, going through the journey in the healthiest way possible. So before we start talking about the different types of ways that you can support your health naturally while you're going through your cancer journey, I do want to make sure that we kind of define some terms, because there's a lot of terms that are often used interchangeably around this topic, but there's some important distinctions. So I want to make sure that you know what those distinctions are, so that as we talk about these different approaches, you have a better idea. On this show, we're all about educating you, and that's why we want to share this information, because I truly believe that when you have knowledge about all the different modalities out there, when you have knowledge about the way that your body works, that then you can reclaim the power in your health. Too many times we just hand over all of the authority and all the power for our health, whether we're going to be healthy or we're going to be sick, to doctors. And, oftentimes it just doesn't work out for us. So let's clarify some of these terms, give you some knowledge on there. So let's talk about conventional medicine first. This is what most people in the Western Hemisphere know. This is the standard medical approach. It's based on treatments like surgery, chemotherapy, radiation, other pharmaceuticals. So this is you go into your conventional doctor and getting one of those types of treatments. It is very it's the most widely used form of medicine here in the Western part of the world. Then there's complementary medicine. These therapies are used alongside, thus the word complementary, conventional treatments. Think like acupuncture to reduce chemotherapy, reduce nausea. There's also alternative medicine. You've probably heard that term. This refers to non-mainstream therapies used instead of conventional medicine. So this approach is not generally recommended by the conventional medicine community because they think it's unproven, even though a lot of these modalities and treatments have been used much longer than conventional medicine has been. But they tend to discourage the use of these types of alternative medicines. Then there's integrative medicine. This is the approach that we'll focus heavily on today. It integrates conventional and complementary treatments in a coordinated way. This is where you work with a holistic practitioner, alternative complementary practitioner, and a more conventional type of doctor or physician, and they work together to help you. So we call it integrated medicine. The goal is optimizing health and quality of life. It's about a collaborative effort between your oncology team and practitioners of complementary therapies. Then there's the term holistic medicine. This is a philosophy that considers the entire person, thus the holistic. We look at the physical, the mental, the emotional, the spiritual, and the social needs. We understand, and we look at these in the assessment and management of health because we understand that no one part operates separate of another. You need to be healthy in all of these areas, the spiritual and the emotional and the mental and the physical, because each one of them, if you're out of balance, it will throw the others out of balance as well. Then we have natural medicine. This broadly refers to therapies derived from natural sources such as herbs, vitamins, and dietary changes. And then functional medicine. This approach aims to identify and address the root cause. Now, this is really, really near and dear to my heart. This is what we prefer to do with our clients is to get to the root cause of your disease by looking at an individual's unique genetics, lifestyle, and environmental factors. It's highly personalized. All of the protocols and everything are personalized to the individual patient instead of just a broad pen that if you have this symptom, I'm going to give you this pill. It's looking at the root cause. We don't want to just treat symptoms, but we want to get rid of what's causing the symptoms so that you can live a healthier, more vital life. So why are more and more people with cancer turning to these modalities other than the conventional medicine? It's often to manage the difficult side effects of conventional treatments, improve overall well-being, reduce stress, and feel more in control of their healing journey. The goal is to enhance quality of life, not to replace life-saving conventional therapies, but to improve your quality of life. I think it's important to recognize that more and more people are beginning to want to take control of their healthcare. They're recognizing that something is broken, something is not working in the system that we have. And so they're looking for different ways to regain some sense of control in the quality of their life. So now let's dive into some specific therapies and what the research suggests, because it's important to look at research. Now, one of the difficulties that we have in the natural medicine world is that not as much money is put into research on the efficacy of treatments because it's not as profitable as, say, the surgery and the pharmaceutical world, right? So more money is put to that, but it doesn't mean that they're not effective treatments. In fact, about 80% of the world uses these modalities more than they use what we consider conventional medicine. They have thousands of years of recorded efficacy in these treatments. So don't, we want to try to get good quality research, but don't think that just because there's less research that it's not effective as well. So we're going to dive into these, but remember to always discuss any complementary or integrative therapy with your oncology team to ensure they are safe and don't interfere with your conventional treatment. So let's talk about mind-body therapies first. So these practices emphasize the connection between our thoughts, emotions, and physical health. They can be incredibly powerful for managing stress, anxiety, and improving overall well-being during cancer treatment. Yoga is one of those. Many studies, including a significant one from Tata Memorial Hospital in 2017, have shown that regular yoga sessions can vastly improve the quality of life for cancer patients, particularly reducing fatigue and anxiety. Yoga combines physical postures, breathing exercises, and meditation, promoting relaxation and resilience during your journey. Meditation and mindfulness. These practices focus on bringing awareness to the present moment, which can help reduce stress hormones and improve emotional balance. Research indicates their efficacy in treating common cancer-related side effects like anxiety, depression, and improving sleep, which is critical for overall health and especially important if you're undergoing treatments for a major disease such as cancer. Acupuncture. This ancient Chinese practice involves inserting thin needles into specific points on the body. Acupuncture has strong evidence supporting its use for managing chemotherapy-induced nausea and vomiting. Studies also suggest that it may be helpful for cancer-related pain, fatigue, and radiation-induced dry mouth called xerostomia in head and neck cancer patients. A 2024, so very recent review, highlights its ability to reduce pain, decrease analgesic intake. In other words, you have to, it can help you to take less pain medications and significantly improve patients' quality of life. Massage therapy. So therapeutic touch can alleviate pain, anxiety, and improve sleep for cancer patients. While research is ongoing, many find it incredibly soothing and beneficial for stress reduction. Now let's move on to nutritional and dietary support. So, let food be thy medicine, as the saying goes. A personalized nutritional approach is crucial in integrative cancer care. So what do we want to do for nutrition then? Whole foods, plant-rich diets, emphasizing fruits, vegetables, whole grains, and lean proteins provides essential nutrients, antioxidants, and fiber. All of these are very important for your health, especially if you're battling cancer. Studies indicate that diets rich in antioxidants like vitamin C and E, omega-3 fatty acids found in fatty fish, nuts, and seeds, and fiber can reduce systemic inflammation, enhance cellular metabolism, and strengthen the immune system, potentially contributing to slowing tumor growth and improving resilience during treatment. So specific supplements, while it's individual for everybody. People's nutrient needs are different, but some supplements are being studied for their potential roles in cancer treatment. One of them that we've talked about on the show a lot is vitamin D. Deficiency is common in cancer patients, not just cancer patients, but the majority of people walking around are deficient in vitamin D. It is one of the first things that we look at with clients because we know that the research is out there of the role that vitamin D plays in the body, in immune system strength, in hormones and everything. So optimizing the levels is we recommend it all the time. Research is exploring its role in cancer progression and immune function. So there is a whole lot of published studies on the effectiveness of vitamin D in helping to alleviate major diseases out there. Omega-3 fatty acids, as mentioned, these have anti-inflammatory properties and may support overall well-being. Inflammation is a trigger of so many conditions in the body. It is not helpful for you if you already have cancer. You want to make sure that you're reducing inflammation even if you don't have cancer, because systemic inflammation frankly is deadly. It kills people. It creates so many different diseases within the body. So you want to make sure that you are doing everything that you can to reduce inflammation inside. Probiotics, supporting gut health. We talk about gut health all the time. It's one of the first things that we look at with people with any condition or wanting to improve their health, is we want to take a look at the gut, especially during and after antibiotic use and chemotherapy. It can be beneficial for overall immune function. Probiotics are super, super important to our overall health. Now, just a word of caution here. It's vital to consult with an integrative oncologist or a registered dietitian experienced in oncology, as some supplements can interact with conventional treatments or have some adverse effects. For example, some herbal remedies like St. John's wort, which is very popularly used, it's widely used in herbal medicine, it can reduce the effectiveness of certain chemotherapy drugs. So we always recommend that before you start taking, throwing herbs or supplements or anything at your condition, that you work with a holistic and natural practitioner to make sure that you, one, are getting what you need and not taking what you don't need, saving you money, but two, that you're also addressing the possibility of any kinds of adverse reactions or contraindications to taking a particular substance. Herbal medicine. So herbal remedies have been used for centuries, for thousands of years. And so, in herbal medicine, we want to talk about a couple of things. One, traditional Chinese medicine, herbs. So these herbs here are often combined with conventional treatment, and they may help people to live longer and reduce side effects and potentially prevent recurrence. For example, American ginseng has shown promise for cancer-related fatigue. But again, you don't want to just start throwing herbs at yourself without having a knowledgeable practitioner in herbalism, natural medicine, holistic practitioner. You want to make sure that you are getting good knowledge and information so that you know what it is that you're taking and any potential side effects. Turmeric, the active compound in turmeric is curcumin. It is huge. This spice has potent anti-inflammatory and antioxidant properties and is being investigated for its potential anti-cancer effects. So clinical trials are exploring its role as a complementary therapy in those who are being treated for cancer. It is a very, very powerful compound spice that has been used for thousands of years in natural medicine. Then also green tea extract. It's rich in antioxidants. It's another natural compound that there's more research being done for the potential benefits in cancer prevention and support. So here's an important note. Herbal medicines are not regulated like pharmaceuticals. Purity and dosage can vary, and some can contain contaminants or interact negatively with medications. So you always want to source from reputable providers and discuss with your healthcare team. Now, let's jump into functional medicine approach. Functional medicine focuses on creating an internal environment where cancer is less likely to thrive. This involves a deep dive into an individual's unique physiology. Think about it like this. If cancer is a fire raging in your body, functional medicine looks to remove the fuel for that fire so that it has nowhere to go and it dies out. So addressing root causes, this might include identifying and addressing chronic inflammation, gut dysbiosis, nutrient deficiencies, and toxicant environmental toxins, exposure to those, and hormone imbalances. Now, one of the things that we do in functional medicine, which is really, really big in our field, is that we want to test and not guess. We want to test to get to the root cause. So we use we test your gut out. We map out your microbiome. We look for hormonal imbalances. We look for toxins that might be bioaccumulating in your body. And we look at your actual nutrient absorption. If you have some types of genetic SNPs, you might be eating what is considered a healthy meal, but your body might still not be getting the nutrients that it needs. And that's why we do these types of tests. Now, you can order a functional medicine lab test directly from Doc Stone's Natural Medicine and Wellness at the website that you see on your screen now. It is docstone.wellproz.com. Use the code Wellness Unleashed at checkout, and we'll give you a 10% discount off of your functional medicine labs. These include the gut testing, hormones, toxins, every type of functional medicine lab pretty much you can see, and you can order directly, easy, right to your house. But in functional medicine, that is what we try to do, is get to the root. So we empower you with functional medicine. We empower you to take charge of your health. So we want to make sure that you are really getting to not just the symptoms that might be, what might have triggered or the symptoms of your cancer, but we want to get to what allowed the cancer to be in your body in the first place. We address that environment so that cancer is less likely to thrive. So we dig into that. This treatment plans in functional medicine are highly individualized. So it's not necessarily the same treatment plan for you as for the next. We actually develop plans to help you to take control that are specific to what is happening with you. These might combine dietary changes, targeted supplements, stress management, and detoxification strategies to optimize the body's natural healing abilities and support overall well-being during and after conventional treatments. So, for example, a patient might be experiencing extreme fatigue. A functional medicine practitioner might investigate mitochondrial function. I guarantee you your conventional doctor is not looking at your mitochondrial function, but they should be. So nutrient deficiencies or underlying infections rather than just treating the symptom. The key takeaway here is integration. The most effective approach for cancer support often involves a team effort where conventional oncologists work hand in hand with integrative practitioners. So one of the things we look at is shared decision making. Because this empowers you, the patient, to be active participants in their treatment plan, combining the best of conventional medicine with evidence-informed complementary therapies. We help manage side effects. Integrative approaches can significantly improve quality of life by alleviating common side effects of chemotherapy and radiation, such as nausea, fatigue, pain, and neuropathy. Improving well-being beyond physical symptoms, these modalities address the emotional and the spiritual toll of a cancer diagnosis, fostering resilience, hope, and a sense of control. So even now, reputable cancer centers and hospitals are increasingly offering integrative oncology programs because they're recognizing the immense value these therapies bring to patient care. These programs often have their own research initiatives to further explore the efficacy and safety of these combined approaches. And so you want to look for practitioners who are board certified and have experience working with cancer patients and who are willing to collaborate with you. That's That's the key. Collaborate with you and your conventional oncology team. So we've had some fantastic questions come in from our viewers. So let's get to a few here. Question number 1, how do I know if a complementary therapy is safe or if it will interfere with my chemotherapy? That's an excellent question. This is paramount. The most crucial step is to always discuss any complementary therapy, supplement, or diet change with your oncologist and entire healthcare team before you start. They can advise you on potential interactions, risks, and if the therapy is appropriate for your specific cancer type and treatment plan. Many unproven therapies can be harmful or interfere with your conventional care, so always educate yourself. Question 2. All right. Where can I find reputable integrative oncology practitioners? Start by asking your oncologist or cancer center if they have an integrative medicine program or can provide referrals. Many leading cancer institutes such as MD Anderson Cancer Center, Memorial Sloan Kettering, and others have established integrative oncology departments with a strong research focus. You can also look for practitioners certified by organizations like the American Board of Integrative Medicine or the Institute for Functional Medicine, ensuring they have specialized training. And let's see, one more question here. Is there a specific diet that cures cancer? Unfortunately, no. There is no scientific evidence that any specific diet alone can cure cancer. However, a nutrient-dense, anti-inflammatory diet rich in whole foods can certainly support your body during treatment, improve your immune system, and enhance overall well-being. It can also help to prevent cancer, so you should start eating a whole food, healthy diet before you ever get a cancer diagnosis. It's about optimizing your internal environment, not about a magic bullet. So remember, navigating a cancer diagnosis is a marathon. It's not a sprint. By embracing an integrative approach, you're not only addressing the disease, but also nurturing your entire being. It's about finding harmony between science and nature and empowering yourself with every available tool. Well, that's all the time we have for Wellness Unleashed with Doc Stone today. Join us next time as we explore the world of natural health. Until then, live well, be well, and stay well. Thank you for watching Wellness Unleashed with Doc Stone on the AeroStream TV network. The opinions expressed by the host and guests of this show are theirs and not the opinions of the network or our sponsors. None of the information shared on today's episode should be taken as medical advice. Statements have not been approved by the FDA or any other governmental authority. And if you're experiencing any kind of illness or wellness issue, you are encouraged to consult with your licensed healthcare practitioner. And we do appreciate you watching our show and look forward to seeing you on the next episode.